Okay, so we're looking at another blood syndrome right here before us. This is what is known as a Bernard-Soulier syndrome. Bernard-Soulier syndrome. Okay. So for the Bernard-Soulier syndrome, you could see it here. Alright. So Bernard-Soulier syndrome is more of like a deficiency in the what? GP1B. Alright. When we're done, we'll talk about the glands maps. So the Bernard-Soulier is a rare genetic bleeding disorder. It's caused by deficiency in the glycoprotein 1B. Alright. So you just say glycoprotein 1B. Alright. But if you want to be so specific, you can just say glycoprotein 1B. Okay. Blood factor 9, blood factor 5 complex. Alright. But you can just say glycoprotein 1B. So glycoprotein 1B is what is crucial in platelet adhesion. So the condition list was like abnormal large platelets. Alright. So platelets are too big, so like bleeding is so prolonged because the ability to come together and clot is kind of like inhibited and stuff. So key features is what thrombocytopenia. So platelets, their number is low, but don't get me wrong, they're actually large, So giant platelets is larger than normal platelets, visible under the microscope. Bleeding tendency, so you can easily bruise. Frequent nosebleeds, epistaxis. Such a woman, if it is in a woman having menstruation, is usually heavy. Then if you are bleeding, it's usually for a very long time. So diagnosis and causes is usually trying to check out if there's causes is usually what mutations in these genes. So diagnosis, you are trying to what pinpoint these genes to see if they are mutated. Also do blood tests to see if platelet levels are low and if platelets are abnormally large. Alright, then platelet aggregation studies, the flow cytometry just to help confirm it. So treatment approach is a platelet transfusion. That's platelet concentrate, right? Antifibrinolytic agents. Okay. Precautionary measurement like avoid trauma and certain medications that usually affect clotting. So it's very rare. You find it in 1 million people. Okay, so that's very rare. Okay. So but that's it for Bernard-Soulier syndrome.